Hey guys, welcome to Medico's Helpline. In this video, we'll learn about pericardium of the heart. We'll deal with the layers of pericardium, the pericardial cavity, and a clinical entity called as pericarditis. Pericardium is a fibrous sac which encloses the heart and the roots of great blood vessels. In this figures, all these layers which encloses the heart is called as the pericardium. The pericardium lies within the middle mediastinum and posterior to the body of the sternum, that is behind the sternum, and second and sixth costal cartilages, and anterior to the middle four thoracic vertebrae, that is from T5 to T8. The pericardium has two layers. One is an outer single layered fibrous sac which is called as the fibrous pericardium, which is indicated by this pink layer, and an inner double layered serous sac which is called as the serous pericardium, which is represented by these blue lines. One layer is the parietal layer, which is in contact to the fibrous pericardium. An innermost lining of the heart is called as the visceral pericardium. The potential space between the visceral and the parietal pericardium is called as the pericardial cavity. The functions of pericardium includes restricting the excessive movements of the heart, serving as a lubricated container in which heart can contract and relax smoothly during the cardiac pump, and it also limits the excessive distension of the heart. Coming to the fibrous pericardium. Fibrous pericardium is a strong fibrous sac and it is conical in shape. The apex of the fibrous pericardium is fused and plundered with the great blood vessels of heart, whereas the bottom portion or the base of the pericardium is fused with the diaphragm. Anteriorly, the fibrous pericardium is related to sternum, the superior and inferior sternopericardial ligaments. Posteriorly, the fibrous pericardium is related to bronchus, esophagus and aorta. Also, laterally, the fibrous pericardium is related to the phrenic nerve. The serous pericardium, as we saw previously, has two layers. One is a parietal layer, which is the outermost layer, and the visceral layer or epicardium. The parietal layer, which is the outermost layer, this is in contact with the fibrous pericardium. Coming to the visceral layer or epicardium, this is in connection to the heart. And the parietal layer is arising from the somatopleuric mesoderm during the embryonic stage, whereas the visceral layer arises from the splanchnopluric mesoderm during the embryonic stage. There are two sinuses between the parietal and visceral layer of the serous pericardium. Remember, these sinuses are between the layers of the serous pericardium. One is the transverse sinus and another one is oblique sinus. The transverse sinus is a transverse recess behind the ascending aorta and the pulmonary aorta, and it is also in front of the superior vena cava and the superior pulmonary veins. Coming to the oblique sinus is a recess of serous pericardium behind the base of the heart. It is enclosed by a J-shaped sheath of the visceral layer, as you can see, and this encloses 6 veins. which are the two pulmonary left pulmonary veins and the four pulmonary right veins. Coming to the nerve supply, the fibrous pericardium and the parietal layer of the serous pericardium is supplied by the phrenic nerves, whereas the innermost layer, that is the visceral layer, is supplied by the branches of sympathetic trunk and also the vagus nerves. Coming to the blood supply, fibrous pericardium as well as the parietal layer of the visceral pericardium, these all are supplied by three arteries. One is the descending thoracic aorta, another one is internal thoracic artery, and also musculophrenic arteries. The visceral layer is having the blood supply which is similar to the blood supply of the heart, that is from the coronary arteries. Coming to the clinical entity called as pericarditis. Pericarditis is the inflammation of the serous pericardium, resulting in the excessive amount of pericardial fluid. As you know, in this space, that is a pericardial cavity, there is a normal amount of pericardial fluid which helps in the lubrication of the heart. But during an inflammation of the serous pericardium, there is excess amount of pericardial fluid which exerts excessive pressure and compresses the thin wall atria. This finally results in the reduction of the cardiac output and produces various symptoms like shortness of breath, tightness of chest and dyspnea. Thus, in this video we learned about pericardium, the various layers of the pericardium, the functions of the pericardium, and the pericardial cavity, pericardial fluid, and also the clinical entity which is called as pericarditis.